Hi again, I'm Dr. Tony. This is Naomi. She's going to be my patient today. We're going to explain how the neck and the low back and the mid back adjustments go and how they work. By explaining, our goal here is to make sure you feel comfortable when you come into a chiropractic office what you should expect. Okay, the adjustments allows the bones to move. You may hear some popping, you may not hear some popping. By that movement, that popping releases pressure. By getting the pressure out of your spine, then your body can relax, not only the muscles and joints, but also over time make it want to stay that way. So your person's health improves with chiropractic. That's our overall goal. So I'm going to adjust. I'm going to have you turn around for a second here. Turn around this side. I'm going to show you exactly where we're going to adjust here in the neck first. Have her lie down in a second. I'm going to adjust these bones here at the base of the skull down to the shoulders here. Okay, that is your neck. You have 7 bones in your neck that go from actually 8 to the back of the skull all the way down to the top of the shoulders. We're going to adjust here. We're going to move things around left and right over time by doing a quick cavitation left and right. Make things want to move better. Okay, you might hear some popping, you may not hear some popping, but the goal is can we cause more motion, ligaments that can stretch to make that motion stay that way. All right, take it on your back for me. Go right here. All I'm going to do is I'm going to have Naomi turn her head to the right. By doing that, now it exposes that left side of the neck for me to move these areas. I'm going to use this part of my hand right here to cause that contact with the bones of the spine. Make sure your shoulders are relaxed. She's breathing normally. She's not tensing up on me. At that point, I get in here. Take a deep breath in. All the way out. Right here. Move that bone just like that. Okay? We'll turn around to the side too. So make sure she's breathing normally, nice and relaxed. Shoulders relaxed, muscles not being under tension. Hold it right there. Take a deep breath in. All the way out. Right there. That allows the bones to move normally. A very quick motion, but a very limited motion because we're not going to rip the neck off. So muscles don't want to strain, ligaments just want to be stretched out. Okay, have you sit up all the way. Now let's go over the mid-back adjustment. The mid-back, take you face the camera one more time. Extra upstairs, turn around all the way. Good. Wait, little Photoshop there. Here, mid-back will contain between here, top of the shoulders, down to about here. Okay, this is the lower back portion. The reason we shift them, we change them around, these bones are oriented or shaped differently than these bones. By having these bones shaped differently, we want to adjust obviously differently too. So the goal here is because the rib cage comes around both sides, it can build up a lot of pressure, causing pressure where there's local pressure here, or even pain where someone breathes in to where it causes pain in those ribs. So we can keep this area loose, keep the body up, the posture up, allows not to build up pressure. We release that pressure now and over time, change someone's posture to make their body stay more straight. Whereas a lot of people, what they'll do is actually hunch forward. Okay? So have you go on your stomach for me, Naomi. Right here. Go face down right here. What I'll do is my contact for here is going to be more of a push straight in. By putting my hands here and here, using this part of my hands to allow my body to stand right over that patient and push straight down. Take a deep breath in. All the way out. Good. Deep breath in. All the way out. Deep breath in. All the way out. And one more time. All the way out. Good. All right. Let's have you sit up all the way again one more time for me. Let's have you face me this way again. So that's the mid-back adjustment. It allows the overall mid-back to stretch. And again, that's a quick force in that area, release that pressure in that spine, even help those ribs on the sides relax too. The next step is getting the lower back to adjust. Also, I include the lower back adjustment as here to here, but also the hips too. They're all part of that low back spine, tailbone, and hip joints on the sides called the SI joints, sacroiliac joints. There's no question about the name. Allows both sides to stretch also, so all these areas allows the areas to move, and these bones here, they move with rotation, but also your hips too. So have you stand up for 1 second, stand up. In the hips itself, here, what happens is these hips can shift up or down, with causing it to pinch the actual spine and the nerves. We make those areas when we adjust someone, yes, adjust the spine to move it, but also make sure those hips want to become more level, so that when the person stands and sits with more of a level lower back, level tailbone, and level hips itself too. So go to your stomach one more time on your stomach. I'm going to show you a quick assessment how we do that in about 15-20 seconds. We do because these hips here are connected to the legs. We check the leg length itself by coming down here, pulling the legs slightly so they're more even, And over time, as you can see, Naomi's leg's a little bit on the left side, a little bit shorter. Okay, but that means that that leg is not shorter because she would walk in a circle. That means that this hip is higher, this hip is lower. What that means also is not just a higher lower hip, because there's actually two vectors there, or secondary motion. This hip comes higher left and in, causing rotation to the front. The right leg being longer will have rotation to the back. Okay, so there's always a secondary motion with the spine. So my job, because the spine's like this now, is to unlock it and shift it this way so the spine will be more level over time. Okay, so have you do, first of all, I want to adjust the higher side first. I'm going to have you do is line your side facing me. Let's go right here. I'm going to adjust the spine here. My contact points will be, yes, the lower back, but also the SI joint at the same time, because I have big hands. I can do both at one time. Okay, have you just bring your leg off the table. It allows more of the lower back to stretch and open up for me to get the adjustment started. I'm going to lean over the person. I'm going to have them take a deep breath in, all the way out. Shoulders relaxed right there, just like that. Okay. Now allow the joint to cavitate. That was what that pop was. Allows areas to move, so now it frees up not only the SI joint, also lower back joints on both sides. Let's switch sides also. Make sure we get the sides even. Now I'm going to do from here. There we go. Good, good, good. Here, it's a little dark on the side. I want to contact that same side right across the back. And now drop that arm down. There we go. Get that pressure out so it makes the hips more even. Okay, let's go on your stomach for me one more time. I'm going to check here again. We've adjusted to make the hips more even. Now let's see what our results are. Okay. How's that look, camera girl?
Better.
Good. More level, right?
Mm-hmm.
It won't stay here, but now from this point on, now that we know what the problem is, what I would do after the adjustment, after you adjusted this part along with the mid back and neck, is now do your exercise to now make things want to stay more level. Our hips have learned, Naomi's hips have learned to stay this as her normal. We're going to, over time, down the line, as we coach her through the post-adjustment guidance, make the exercise, make these hips more level so they stay this way. So grab a seat for me. Facing the camera. Our job is, yes, to adjust the spine, move the bones, all things that release that pressure in the joints mechanically. But the result is, when we talk about how the adjustment works, relaxes nerve pain down the arm, down the leg, causing headaches to go away too, causing eye pressure to go away. There's probably about 50 symptoms I can actually mention how the body works when it gets better. People come in here with chest pain because they have ribs that are stuck too. We adjust the ribs, loosen things up also. This way adjusted is more of a common way to adjust people. There's about 14 ways to adjust the neck, mid back, low back. I'm going to show you just a common to make sure you're comfortable. When you come in the office, make sure you're relaxed with your doctor. Make sure you tell the doctor exactly what's going on. Make sure you communicate with the doctor, because everyone's different. That way you tell them what works for you once you've been adjusted, how it helps you and how things work over time. All right, so any questions, give Naomi a call, give me a call. What's going on? If not, you guys have a great day.